And the last part of our focus for today is again trying to understand how the tool that is used, the Diagnostic and Statistical Manual of or of Mental Disorders, how that is both beneficial and also problematic due to the labels that are used and how uh, labels that are given with psychological disorders tend to differ in the way that we view people as opposed to a medical label, as if an individual has diabetes or an individual has um, some other medical condition. We just tend to view people differently. So with the Diagnostic and Statistical Manual of Psychological Disorders, it is currently in its fifth edition. It was released and the fifth edition was released rather in 2013. Periodically, it does go through revisions where new disorders are added, other disorders are removed. But ultimately, if you are interested in looking at the DSM, it is in the library here at Southwestern or most public libraries. It is also available. But if we look at trying to classify psychological disorders, there are some benefits into how this tool is used and why it is used. Number one is the diagnoses that are given. If we diagnose an individual having generalized anxiety disorder or illness anxiety disorder or bipolar disorder, this does create a shorthand that clinicians know, whether that be a doctor or a clinical psychologist, that they know how to refer to the various symptoms that are associated with the specific psychological disorder. So they already know what to expect when an individual goes to a therapist or goes to a doctor, and as part of their health history, they may list that they have been diagnosed with major depressive disorder. In addition, as the DSM is revised, there is always research going on to better understand the symptoms and the treatments, and which treatments tend to work best with which psychological disorders. So the diagnoses allow for the research to continue and for the statistics to be gathered, so that we can best hone in on specific treatments for very specific disorders, because we want to always lead to the best outcome for individuals. And also, lastly, as you see there, the diagnosis can guide treatment choices based upon research. We know that there are certain disorders that can only be treated medically through the use of prescription medication, whereas other disorders might need the use of a combination between medication as well as a psychotherapy where they go and talk with a therapist and either learn some strategies to cope with anxiety or to better manage stress, or to reframe cognitions. There are, again, certain disorders where a combination of medicine and those types of therapies will work best, whereas others, just medicine alone can be used to treat the disorder. However, despite the good things of the DSM, there are some criticisms that do come with the DSM as well as the labels. Number one is some people feel that the DSM has way too many psychological disorders listed, which can lead to almost too many people being diagnosed with a psychological disorder. Some also say that the line that we use to draw between what is normal behavior and what is abnormal behavior, it tends to be very arbitrary. For most disorders in the DSM, the number of symptoms that an individual has to manifest over a certain period of time is usually 5. So the question becomes like, why 5? Why not 4? Or why not 6? Why not 7? So that number of 5 just tends to be it tends to be rooted in research, but some people, again, say that it is a little bit arbitrary of a number. And lastly, excuse me, when we look at diagnostic labels, we know that this very much has an impact on the way that we view individuals who have a psychological disorder. There tends to be a stigma, and we are doing better as a society with trying to end the stigma that surrounds individuals with being diagnosed with a psychological disorder. As more and more people are seeking help, it is becoming more accepted from healthcare to treat psychological disorders as it is almost a medical disorder, as opposed to just it being a psychological disorder and being treated just by psychologists. There's again a shift that is occurring societally, but it's a very slow shift that is occurring. So with the stigma that surrounds us and how we view individuals with psychological disorder, as you see there, we tend to think very differently about an individual who has a psychological disorder. If you meet a new person and the person tells you that they were diagnosed with bipolar disorder, and through different interactions with them, you see that they start to illustrate behaviors that we would associate with the high stages, the manic stages of that disorder, and then other times they display uh, the, the depressive state of the bipolar disorder. It again can kind of affect how we key into the times that they display those highs and those lows, and sometimes we misinterpret an individual being manic when in fact they may not be in a manic state at all. And again, it's very different how we view individuals with psychological disorders as opposed to an individual who just has a medical diagnosis. Again, we're trying to do better as a society. We're growing slowly, but I think we're on the right path in terms of helping to end the stigma. And I think we do a good job trying to educate students here at Southwest through various assemblies, or even by taking AP Psychology or Intro to Psychology, just to just have that familiarity with it being okay to seek help. You have to take care of your mind and your brain just as much as you would, if you have a cold or if you have the flu. You seek medical attention for that. The same is true if you are feeling a depressive state that just won't seem to go away on its own, and it's been persistent for 4 weeks, and you've had suicidal thoughts, or you are more reclusive, not as social as you used to be. So it is again it is important that we address that as a medical disorder, in addition to just just it being a psychological disorder. And then lastly, as we look at just the prevalence of psychological disorders, by far and away, the United States, when compared to other countries with similar populations and similar um, uh, industrialized status, the United States is by far and away the country that seems to have the most of individuals being diagnosed with any psychological disorder, as you see there on the blue, and then we also have the most percentage of individuals being diagnosed with serious mental or serious psychological disorders. And the question really becomes why? What is unique about the United States compared to other countries? Is it the fact that we're getting better at diagnosing individuals and treating? Is it, just the way that psychological disorders are viewed in these other countries? There's still a lot of research in that as to why that is specifically happening more so here in the United States than anywhere else. One factor, though, that they have found on a correlational standpoint is in the United States compared to many other countries, is there is such a major difference in wealth. Those that are very wealthy and well-to-do versus those that are poor and struggle to gain access to healthcare. In addition to the way that an individual's race in the United States has affected how we view people, and how at times healthcare and other psychological care was not always provided for individuals of different races or of different gender as well. So as we look at that difference in terms of the wealth, one of the correlational predictions is poverty. Some question and say that, if an individual is living in poverty, the individual may not be able to gain access to healthcare to treat the psychological disorder. They may not be able to maintain a job that allows them to have access to healthcare to treat the disorder, as well as if they can't maintain a job, then they're they're not necessarily able to get out of a poverty environment. If they can't earn money, they can't get out of that. And at the same time, if you look at individuals who are exposed to frequent stressors and just the demoralization of living in poverty and the stress that comes with living in poverty, it can potentially also lead to the likelihood of an individual developing a psychological disorder. And we'll get into that a little bit more as we look at how genetic predispositions and the environment can interact with one another. And then lastly, as we look at just the rates of psychological disorders in the United States, one of the most commonly diagnosed is mood disorders, and very specifically is depressive disorders. Then from there, phobic disorders, whether it be of a specific object or of a specific situation. Social phobias as well might fall under that phobic disorder as well. And then we go to ADHD, post-traumatic stress disorder, and then anxiety and our anxiety-related disorders. So generalized anxiety disorders, OCD, PTSD we would consider as part of that anxiety and anxiety-related disorders. And then kind of getting on the smaller scale, are psychotic disorders, things like schizophrenia, where we have the individual that has a true disconnect from reality.